Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health-related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease-free life. To help us in this regard, we'll be joined by eminent and expert top doctors from across the country. Today in Doctor Speak, we are going to talk about the problem of PCOS and ways to help you deal with it. Hello, this is Aprajita Mehra, and you're watching Medicircle. Today on our PCOS awareness series, we have Dr. Ayan Mukhopadhyay with us. Dr. Ayan Mukhopadhyay is one of the best gynecologists in Kolkata. He specializes in different areas of gynecology, which includes high-risk pregnancy, infertility treatment, endometriosis, uterine fibroids, ovarian cyst, ectopic pregnancy, laparoscopic surgeries. He also deals with other different gynecological problems like IUI, intrauterine insemination, IVF, in vitro fertilization, surrogacy, hysteroscopy, transvaginal ultrasound. So we are very proud and privileged to have him join us on Medicircle today. Welcome to Medicircle, Dr. Ayan Mukhopadhyay. How are you, sir?
Thank you. I feel glad to be here.
Superb. So shall we start on our journey to unfold more about PCOS?
Yes, please.
All right. So my first question to you, doctor, would be what PCOS does to our body?
Well, we have to know that PCOS is something that is a lifestyle disorder to certain extent. So it does a few things to our body. It is a systemic disorders. What is type of systemic disorders are? That is, it involves multiple systems of our body, including the hormonal profile, including the cardiovascular system, and almost has effect on everything that a woman does. And if she has a diagnosis of PCOS, she is going to have the following symptoms, that is irregular menses, a bit of excess hair growth called hirsutism, and along with that, she might be having either absence or very scanty flow of menses, and the date of the menses may be delayed. Along with that, due to hormonal imbalance, she might be facing a breakout of acne, and along with that, hair loss, along with that, unwanted hair growth in unwanted places, along with that, due to visceral obesity, she might be having a protruding tummy that may be a bit difficult for her to express herself. It might affect the way she sees herself and the way she thinks that people see her. So these are the things that actually PCOD does to us. Along with that, the most dreaded problem with PCOD is the infertility that it causes in a long run if kept untreated.
All right. So if we look at from a woman's perspective, this is something very serious. So what are the symptoms of PCOS? A lot you have covered in our first answer, but what are the other symptoms that a woman can easily look at and understand that she might be going through PCOS or PCOD?
Well, if she had been normal at some point of time, now suddenly she faces a increase in weight that she cannot explain. Suddenly she puts on, and suddenly she finds it difficult to get rid of the extra weight in spite of working out or controlling her diet. Most probably she is going towards some hormonal disbalance that might be predisposing her towards developing PCOD. And other symptoms I have already talked about. It might be oily skin, breakout of acne, loss of hair fall from mainly from the frontal area, the front part of the scalp, and in difficulty in losing weight, gaining a lot of weight quickly, or might be she is facing some issues with her menses. That is, the menses are either getting delayed, the number of days for which it stays, that is becoming shortened. Previously she used to have for 3 to 4 days, now she is having for 1 day. the flow is reduced, the amount of blood she used to lose, that is reduced, or either she is having some form or the other of the irregularity in her menses, mainly not increment but decrease of the amount or the number of days of flow. And along with that, for a married woman or for someone who is trying to beget a child, uh, if she is having this type of difficulties, then she might face a difficulty with conception also. So these are the main symptoms.
Right.
And then there are long-term risks also.
Mm-hmm.
Long-term health risks are also there associated with this diagnosis. A person diagnosed with PCOD is predisposed to, in the long run, getting a diagnosis of type 2 diabetes or developing high sugar during pregnancy, which is called GDM, gestational diabetes mellitus, or cardiovascular risk factors like an altered tests results in the lipid profile, cholesterol, triglyceride, etc., and an increased risk of cardiac diseases or cardiovascular diseases like hypertension, pressure, etc. That can also be a long-term effect. Along with that, if for those women, I know maximum of them are very conscious about it, about their looks. So I told you previously that this might be affecting the way she sees herself or she thinks that others see her, because of the way she has to carry her body, and she becomes increasingly aware of the things that are going on with her. Might be her friends and peers are poking her about the acne or hair loss or the tummy that she has developed. So that may be also a problem.
A lot of physical issues, building up into more emotional and psychological issues. So, of course, PCOS.
Definitely, we are finding women. They have been diagnosed with USG, and before coming to me, they have Googled this thing, and then when they have researched about what are the long-term effects or effect on pregnancy, then they get a bit depressed, and they come with their moms, and the mom tells me that my daughter has been crying and upset since she has read about it.
Right. So, when does this PCOS become dangerous for a patient? What is the time when we
Well,
should at least
everything in
start getting
anything
concerned?
becomes dangerous if not treated in due time. The best way to treat, the best timing to get treatment started is early. These things actually, like many other things, actually are better treated when they are in a stage which is more treatable by medicine and by lifestyle changes. Actually, many women are doing well with just only lifestyle changes without any medications. Lifestyle changes like modification of diet, regular exercise, healthy habits, timely waking up, timely exercise, small amount of weight loss, trying to do that. Many women are doing well with this, and those who require medicine also, they will do better if they start early. The earlier the most the better, the earlier the better. So if you are having a problem with your menses, consult your doctor, get a USG done, get your blood test done, and have a confirmation of your diagnosis. If you are having this thing, then get it treated promptly. At least start the treatment. Not if not by medicine. If you have an issue with taking medicines, I don't want to start them right now. Then at least try to change your habits. Those can be very helpful.
Right. So you have shown a little bit of hope there for a lot of women and especially adolescent girls, that it is not all, very serious or dangerous. But if with a advice
Well,
of a
with the
doctor
with the
and a
with
proper
the with
modification and lifestyle, they can, hope to combat it a little. So is there any
with the
way? Yeah.
taking the word from you, hope, the word that you used. I came to know about this support group called Varity, VARIETY, and you can search, if anyone can Google it. There is a support group throughout the world, and also Indian women are also there. So after I have suggested to join this group, many women have found a lot of help after joining this group regarding the mental issues involved in it, the treatment, the lifestyle changes, and also motivation regarding losing weight and everything, they have found a lot of help and hope after joining this group.
How wonderful is that? So we have women all over the world coming together to support each other, to help us,
Yeah.
help each one guide through this, problem. So that is such a lovely thing. And I'm so glad the doctor suggested this to us, so that through our medium, through our channel, a lot of women are going to be aware of this now, and they are going to find help and support and some hope in each other. So, sir, that brings us to our last question for the interview. And my last question to you would be, sir, is there any pain associated with PCOS? And if at all there is, then where is it located?
PCOS itself will not cause any pain. If you are having pain in your lower abdomen, the lower part of your tummy, if you are having pain during menses or during any time of the month, you need to consider 2-3 things. Something is either wrong with your gynecological structures, that is the uterus or ovaries. There may be endometriosis, there may be endometriosis, there may be n number of other diagnoses, there may be even a simple urinary infection also that can cause a lower abdominal pain. But PCOD itself will not cause the pain. The main association of one disease, that is endometriosis, that is a irregular and abnormal distribution of the inner lining of the womb outside the womb. This is called endometriosis. It's sometimes associated with, we find the association between PCOD and endometriosis, and sometimes we find that the woman actually was ascribing the pain to the PCOD because endometriosis was not diagnosed by that time. PCOD was diagnosed, but after she told me that I also have a pain, and then I started diagnosis and working her up for query endometriosis, whether she has it or not, and then I found her to have it. Then I could explain that yes, that's why you are having the pain. It is not due to the PCOD itself, it is due to other gynecological problems that may be there hidden in your tummy.
So thank you so much for coming on our show. Is there any last words, any message for our women out there or adolescent girls that you would like to ascribe for this problem?
The last word would be that awareness is the main dogma. So be aware, make your friends aware too, and it is bear in mind that you are not the only one who is suffering from it. Though this disease does not have a proper cure, but it has got a good management. If you start early and if you are motivated, then nothing will be a problem. Not only the lifestyle, not only the menses, even the fertility issue will not be a problem if you are motivated enough to see your doctor. That I'd like to end the session like this.
How wonderful. Thank you so much, doctor, with those lovely and amazing words. We are going to end this interview. Thank you so much for coming on our show. And on behalf of everyone here at Medicircle, I would like to thank you. It was really a pleasure having you today. Thank you, sir.
My pleasure. Thank you.